Hi, good afternoon. My name is Melissa. I'll be your nurse today.
Hi, Melissa.
Hi, my name is Zoe and I'll also be your nurse today.
Hi, Zoe.
Can I please get your name and date of birth?
Carrie Ibarra, 9/14/85.
Hi, Miss Ibarra.
Hi, and I see you brought a family member with
My
you
sister
today?
Yvette.
Hi, nice
Hi.
to meet you.
Hello.
Okay, so you came in for your labs today and they indicated that you actually have gestational diabetes.
Oh no, what's that?
So I actually have a PowerPoint that can help you understand what gestational diabetes is.
Okay, great.
Okay. So diabetes. Diabetes is actually a long-lasting condition where the sugar in the blood isn't properly used in the body.
Will it go away after this pregnancy?
Yeah, it should. So gestational diabetes is where you have diabetes during your pregnancy, and it usually resolves itself after you deliver your baby.
Okay.
Yeah, and you can always come back for your labs after you deliver your baby just to make sure that your blood sugar levels are in the range and you don't have diabetes.
Great.
And you're usually at low risk if you manage your diabetes properly throughout your pregnancy.
Okay.
What do you mean by managing?
So, by managing the gestational diabetes, it includes eating healthy, which includes eating higher protein, low carbs, carbohydrates, and increasing your intake in fiber. You can also increase your fruits and vegetables. You can also stay active by doing light to moderate exercise for about 30 minutes each day.
So we usually take morning walks. Would that count?
Yeah, morning walks is a very good way to stay active.
Is this going to affect my baby?
Actually, yeah. So there are some effects on you and your baby during this, and then some effects that could happen to you is possibly a spontaneous abortion, gestational hypertension, which is high blood pressure, a preterm labor, you deliver your baby early, or infections, UTIs. Those are normal conditions that can happen during when you have diabetes. A possible C-section or at risk to develop diabetes after your pregnancy if they're not manageable, like mentioned earlier.
Okay.
And for your baby, there could be some abnormalities with your baby. A large baby is also an effect, yeah. And it's because of those blood sugars levels are so high that it's feeding your baby and making your baby grow large.
Okay.
And because of that, after the baby's born, it's prone to have hypoglycemia because there was such high sugar levels while in the womb. So after it comes out, then those blood sugar levels drop.
Okay.
And you could have injury during birth because of the increased size in your baby as well.
Oh my. Okay.
And then
How will she know, like, if her sugar's running, let's say, high?
so for high blood sugar, you will have some signs, urinating a lot, excessive hunger, excessive thirst, nausea, vomiting, a fruity tone on your breath, and like when you're rapidly breathing, you're breathing really heavily and really fast. Those are signs of your blood sugar is like really high.
Okay.
So you want to check your blood sugar. And then there's an acronym. If your skin is warm and dry, your blood sugar is high.
Okay. How clever. Okay.
And if it's low, will it be the same symptoms or?
No, actually for low symptoms, so for low blood sugar symptoms, you're gonna have a headache, you might feel weak, you can have shakiness, you might have blurred vision, and you might be your sweating might increase. So a good acronym for that, it could be cold and clammy, I need candy. So that means you would have to intake sugar, that way your blood sugar regulates.
Okay. And will I need to be on any medications for this?
So if your blood sugar is low, it is wise to possibly keep like a snack, like a sugary snack with like a protein bar. So after you ingest that sugar, you can
Check your sugar.
yeah, you can eat the protein bar and it helps with the sugar. It makes it last longer in your body.
Okay.
The way you can check your blood sugar is going to be with one of these not this, I'm sorry. With one of these,
A glucometer.
Okay.
So when you get these from the pharmacy, you can just keep it in here and make sure you keep your glucometer and your test strips with you, and then also a stick to poke.
Okay.
do you know how to use it?
I don't. Can you guys go over it with me
Of
briefly?
course.
So first thing, you're gonna have to wash your hands before you open your,
Yeah. Before you start, you want to wash your hands or sanitize.
Okay.
And then you'll open your alcohol strip. Wherever you would like to check your blood sugar, you use the tip of your fingers, and then you can kind of tap and make sure it's like a little warm. You're going to clean with the alcohol, the sanitizing pad. If I can get it out. Okay. You're gonna wipe, let that dry, get your testing strip. It'll probably be wise to do this before you start. Gonna get your testing strip, turn on your glucometer, and then you're gonna administer the strip in here. Okay, I'm gonna hold that from here. Okay, you're gonna clean with the alcohol pad. You're gonna take the cap off the needle, press against the spot where you cleaned.
you hear
And
a
you're gonna
click.
push down and you're gonna hear a click and it's gonna poke your finger.
Okay.
You're gonna get a small drop of blood on your finger and you kinda wanna push just a little bit just to get a good amount of blood. And you're gonna lightly tap until there's enough blood on the strip, and it'll turn on and it'll give you your reading.
Okay, great. Thank you.
You're welcome.
And then a normal blood sugar for you would be above 60 and below 120.
Okay.
And then when you do go to the pharmacy, just make sure you get a sharps container, and when you pick up your strips, and dispose of your needle in the sharps containers so we don't have any accidents.
Okay, great.
And if your blood sugar is high, whatever reading you have for your blood sugar, you'll have a sliding scale which gives you the ranges for your blood sugar and how many units of insulin you need.
Okay.
So if your blood sugar is, let's say, 230, and it gives you 4 units of insulin, you're gonna grab your pen, and then you're gonna prime it to 2 every time, and you're gonna press on it to prime the needle, and then you're gonna inject the insulin. There's about like 3 areas on your body where you can inject it: the back of the arm, the lower abdomen, and your thigh.
Okay.
You want to get the fatty areas on your body, and you are pregnant, so you might want to avoid the abdomen area. Like, you probably won't feel as comfortable doing it there.
Okay, makes sense.
Yeah, so you can use your thigh,
Okay, great.
and just make sure you rotate the sites, and you want them like about 2 inches apart.
Okay.
So to use the needle, you're gonna wipe the top of the needle, the top of the pen, with an alcohol pad for 10 to 15 seconds. You're gonna grab your needle and you're gonna clip it on and twist it. And there is a cap on the needle. After you prime, go to the amount of units. So in this case, we need 4. You're gonna take off the cap, inject it on the side at a 90-degree angle, push down until it goes back to 0. Wait about 5 to 10 seconds, and then you can release.
Okay.
And
Thank you.
dispose of your needle in the sharps container as well.
So it's just always gonna be insulin, right?
Yeah. Well, these pens are actually pre-filled. If you manage your diabetes well, your doctor probably won't prescribe you insulin. If you do end up eating insulin, it'll usually be in this pen. There are oral forms of pills used for diabetes, but they typically use insulin.
Okay, so the pills won't be used during her pregnancy?
Most likely not. It's not
Okay.
recommended.
Okay.
Perfect.
It is contraindicated, but it could possibly get to that point.
Okay.
I just wanted to add for the pens, always make sure that they're not expired and that it is for you and it has your name.
Okay.
In storing them, you wanna You want to keep them at room temperature. You can store it in the refrigerator, just never freeze your ants in. You can store your other pens that you're not using in the refrigerator though.
Okay.
And keep out of your car or in hot areas.
Okay. That works.
Do you guys have any questions for us?
I don't think so.
Not at the moment. I'm still kind of processing everything.
Yeah, I know it's a lot to
I appreciate you,
process.
ladies.
Of course.
Thank you.
And if you need any recommendations, any care groups or anything like that, just let us know, and we'll see what our facility offers.
All right.
Okay,
Cool.
great, thank you.
Thank you.
No problem. See you at your next visit.
Thank you, Melissa.